Good morning, everybody. I hope you're having a good time in Vegas. This is a great place to have a seminar. So we're going to talk about expanding opportunities for pharmacy technicians. Okay, oops, let's see how this works. So we have a couple of objectives today, identifying training, certifications, and competencies needed to enhance pharmacy technicians' roles, and the needs and future opportunities for technicians as a result of PPMI. Welcome. Okay, is this better? Okay. So a quick poll. How many pharmacists do we have in the audience? Thank you. How many pharmacy technicians? Okay. And how many students? Any students? Okay, well, welcome everybody. This kind of gives me a little gauge of how I'm gonna go about the talk. So we have a couple of assessment questions. I'm gonna have to stay here. And we're going to answer those at the end of the presentation, but just to give you an idea, we're just going to be looking how important is the integration of pharmacy technicians on the new roles and responsibilities. And with the new roles and responsibilities for technicians, how is this going to continue evolving the pharmacy landscape? So when I was doing this presentation, I decided to just go back in a little history because I feel that technicians' role has been expanding all along. It's just being very slow. So, and it was very interesting to find out that our journey started back in 1966. Well, back then we were called pharmacy helpers or pharmacy clerks or pharmacy assistants, depending where you live in what state. And it was then when American Association of Colleges of Pharmacy and the American Society of Hospital Pharmacists at the time developed a joint statement saying that technicians needed to have some sort of organized training program. And, you know, kind of, I guess, something, it was said, but I don't think there was no guidelines given, so it just kind of has taken a long time for that to happen, and we're still working on that. So it was in 1976 where ASHP created the training guidelines for hospital pharmacy supportive personnel. And then later on, Michigan decided to come up with a certification program for pharmacy technicians. In 1983, ASHP began an accreditation program for pharmacy technician training. So you can see how it has taken almost 20 years to come from the one statement to the actual coming up with the technician training guidelines. In 1995, again, a few organizations got together and they decided that we needed to create the Pharmacy Technician Certification Board, PTCB, as an independent body to create and administer the National Voluntary Certification Exams. At this time, there was already two tests that were given. Michigan had one, Illinois has one. So they decided to combine forces and just become with one national exam, which most of you probably are certified by PTCB. And in 1996, ASHP released a white paper on pharmacy technicians and publishes the model curriculum for pharmacy technician training. And at the time, actually, I was teaching, and this was very exciting for those of us that were teaching pharmacy technicians at the time, because actually we had something now that we could actually use to develop our curriculums. 2002, ASHP released a second white paper urging the development of vision for pharmacy technicians and the definition of responsibilities and functions, standards of education and training, and regulatory framework for pharmacy technicians. In 2005, it was developed the EXEP certification exam, which was an exam done to compete with PTCB, but it's more retail-oriented, and the purpose was to get more technicians certified and have some basic competencies. And then the latest paper has been in 2009 by the Council of Credentialing in Pharmacy, where they released a document of policy development regarding education, training, certification, and regulation of pharmacy technicians in the United States. And actually, this paper has been very important on the recommendations on PPMI. So to give you a little background, I started as a pharmacy technician back in 1987. And when I started, well, we didn't do a lot of things. We were just starting to compound IVs. We were really good at doing unit dose cart fill. That was one of the things that we did well. We did some compounding, and we were starting on doing unit dose in a lot of the hospitals, so everything, it's not like today where you get unit dose. You actually had to repack almost everything that came, you know, because everything was in bulk and we just had to repack. So that was one of the things that we did a lot of it at the time. The technician programs were taught by pharmacists. The one that I went in South Carolina, it was taught by 3 pharmacists at the time. Some of the hospitals didn't have computers yet, so we used to use this 4-color pen to do all the profiling, and that was like the first thing we did every morning, is just to profile the patients that we had, admissions, new admissions, so we can then start printing labels and doing what we needed to do. And at the time, I worked for Medical University of South Carolina, and only pharmacists compound chemotherapy and very expensive drugs because they didn't want us to like mess it up, and then it was a lot of money that we were gonna have to expend. So, and all these things, of course, have evolved. Oops, did I miss something? Yeah. So today, technicians do a lot more. There's ordering of medications, monitoring and maintaining automated dispensing machines, supervising and training other technicians and pharmacy interns, and even pharmacists when they come in on operations and technology. Database administration. We act as a resource for pharmacy benefit management reconciliation, instructing pharmacy technicians, and working on organizations, pharmacy organizations. And some pharmacy technicians actually own their own retail pharmacies. Technology actually has had a lot of impact on that because as technology came, pharmacy technicians were the ones that took the technology to heart and started, learning all the new robots and machines and all the different things that we have in the pharmacy. And so these actually have helped advance technicians and allow technicians to take additional roles in their pharmacies, and they have created new roles for technicians also. It also upgraded traditional roles where an inventory clerk at the time now is called inventory management technician, and they're actually helping in the recall and drug shortages and issues, barcoding, scanning, robotics, and tracking of medications. It also has increased the number of career technicians because for a while, those of us that are being in the industry for a while, technicians work sort of like you came, you did it for a few years, and then you went to do something else. But now I have seen a lot of technicians that are stay in the field and they actually retire from their hospitals or wherever they work because they have found, I guess technology in a way has given them that wanting to be part of the team. So now we had to ASHP PPMI, which is in 2010, and there's 2 recommendations for technicians. And the first one is pharmacy technicians who has appropriate education and training and credentials should be used to free pharmacists from drug distribution activities. The second one is assigning medication distribution tasks to technicians will make it possible to deploy pharmacists to drug therapy management services. And they also have made some suggestions, and these are the tasks that they're suggesting that technicians can do. Initiation of medication reconciliation, which we're going to have a nice talk right after this one. including obtaining and documenting patients' medication information for pharmacist review, reviewing patient charts to identify medication allergies, checking dispensing by other technicians, compounding routine sterile preparations in conformance with well-documented procedures, dispensing medications with remote video supervision by pharmacists, scheduling outpatient clinic drug therapy management visits, criteria-based screening of medical records to identify patients who may require pharmacist intervention, preparing clinical monitoring information for pharmacist review, inspecting and replenishing medication storage devices, and managing controlled substance systems. So these are all the suggestions for PPMI. Again, continuing managing medication assistance programs, conducting aspects of quality improvement programs, managing pharmacy department information technology systems, supervising other pharmacy technicians. So PPMI has had an impact because since this has happened, some of these were already in place on some of the hospitals, but actually now the roles they're also evolving, and more hospitals have actually taken. They're actually developing all these different positions and roles. And I'm kind of curious, is anybody here in the audience on a non-traditional role? What do you do?
Some of the quality assurance things, almost like checking charts or various aspects of the director logs, building spreadsheets.
Great. And when did you start doing this position? About a year ago. I'm sorry?
I got a bunch of questions from stuff earlier. We have some time afterwards.
Yeah, we're going to have some questions. After her presentation, we'll have some time for questions. Because we're trying to fit in both presentations into 1 hour. Anybody else? Yes?
Medication safety.
Oh, awesome. Awesome.
Training coordinator, and then now supervisor technician.
Great, great. So let's talk a little bit about decentralized clinical pharmacy technicians. Depending on the setting where you work, I mean, you can, it could be anything from being a nursing liaison to a customer service to troubleshooting missing medications. They assist pharmacists in processing patients' own meds, locate non-formulary medications as needed, narcotic inventory counts, units inspections when we're allowed, assist with investigation and medication errors, participate in quality assurance audits, project team leads, staff technology trainers, and maintain automated dispensing machines. There's also a new role in decentralized technicians that has come up where technicians actually, there is a couple of hospitals where they're using pharmacy technicians to pull the medications for nurses. So instead of the nurses going to the Pyxis machine or Omnicell, whatever they have, and pulling their own meds, actually pharmacy technicians pull the meds, and then there's another check by the nurse before they administer. So this is something also that is coming to play. We also have OR technicians, and this is also changing because a lot of the anesthesia rooms now has anesthesia carts where they pull the meds. So technicians are not really doing the boxes like we used to do traditionally, but then the technicians actually has to go there after the case and restock everything for the next case. And I'm told that I need to go a little faster. So ED and medication reconciliation technicians, this is also a new role that is expanding, and Dr. Denon is going to be giving us a really good, more information about medication reconciliation technicians. Technician supervisor, this has also come up as, well, one as a title, and there's also a lot more things that technicians are doing now. At a time, we were called technician leads, but now the actual supervisor, and even some hospitals have pharmacy technician managers. Informatics technicians, these are the ones that actually there's a lot of technicians now working on developing the databases and working on the actual systems for the pharmacy that, to support the financial billing and revenue of information systems. Inventory management technicians. This actually has expanded also, this role. When you used to just put away your inventory and just check that it came in, now you actually have more responsibilities where you actually had to find drugs that are, shortages. You actually have to do all the recalls and make sure that everything is in compliance whenever you provide the training to the other staff to kind of being able to cover for you when you're not there. You manage, you coordinate the annual inventory for the pharmacy and support all the inventory changes based on the P&T decisions. TechCheck Tech, like we all know, we have TechCheck Tech in California, and we actually just finished with all the guidelines and we actually put together a really nice presentation that I think is going to be launched here at seminar. There's going to be this whole packet for pharmacists, directors to be able to implement TechCheck Tech in their facilities. So all this is going to be either launched here at seminar, or it's going to be on the website pretty soon on the CSHP. So I'm kind of going fast in here, so let me see. Just give me 1 second, guys. So what is the common theme? The common theme of all the slides and everything that I have talked about is that technicians need to be trained, they need to be qualified to be able to become into the expanding roles. So how do we get that? One of the things is you need to get involved. You need to get involved in your jobs, wherever you work. And of course, I work for Sutter Health, so I have Sutter Health up there as the workplace. But there's many places where you can get involved and you can get your training and you can get participate on the different opportunities that will present. Like in your workplace, you want to be able to participate in committees, volunteer. And I know sometimes it's a little intimidating, but if you don't tell your pharmacy director, I want to do that, how can I get it on working on that? Can I participate in that? They're not really going to know that you're interested. So one of the things that you want to do is, try to take advantage of any training or learning opportunity that comes to work and ask a lot of questions. It's okay to ask. You can always, if you get a no, it's a no, but you should continue asking. And make a proposal. If you know that you can do something and that's gonna make pharmacists' job easier, or they're going to facilitate them to be able to go into the floor and do other things that are more clinical, then propose that to your director. There's also opportunities at a state level. CSHP have provided a lot of opportunities for technicians, and now CSHP is actually Technician Division is transforming into the California Pharmacy Technician Association, so there will be even more opportunities for technicians to learn and grow. At the national level, ASHP has a section advisory group on support services, which is mostly for technicians. So become involved. Same thing with PTCB. There's a lot of opportunities to volunteer and to learn new skills. So my vision of technicians in the future is that I see technicians managing the pharmacy operations and quality activities, acting as experts in compounding and repackaging, managing the pharmacy inventory, technology, and databases. I know you can do it. Pharmacists, what I see is working side by side with physicians, providing clinical expertise, and/or counseling patients in medication management and compliance. And the self-assessment questions, because we need to do this as a requirement for a CPE. So which of the following are important to the effective integration of pharmacy technicians in new roles and responsibilities? Number D, all of the above. So it's true or false, the pharmacy landscape continues to evolve and offer new roles and responsibilities for pharmacy technicians. It is true. You're there, you're here, and you can do it. So don't hesitate. Thank you, guys. And now,